Welcome to PTCB Prep Guide. If you're watching this, you're already one step closer to passing your PTCB exam. Today, we are tackling a huge topic, blood clots, also known as thrombosis. We're going to break down what they are, why they're so dangerous, and most importantly, the medications you absolutely have to know for your test. So here's the game plan. First, we'll cover the basics of what a blood clot actually is. Then, we'll talk about what happens when things get dangerous, when clots go rogue. We'll look at who's at risk, the two main drug strategies we use to fight clots, and then we'll do a deep dive into the specific drugs you'll see on the exam. And of course, we'll wrap it all up with a high-speed review of the top takeaways. You ready? Let's do this. All right, first things first. You gotta know that not all blood clots are created equal. Where they show up in the body, whether it's in an artery or a vein, changes everything. This is a really key distinction, so let's get it straight. Okay, let's break this down. On one side, you've got arterial clots. These guys form in arteries, the vessels that carry blood away from the heart. The main culprit here is usually plaque buildup from atherosclerosis. And if one of these blocks an artery, well, that can lead straight to a heart attack or a stroke. Now, on the other side, we have venous clots. These form in your veins, and most of the time, we're talking about the deep veins in your legs. That's what we call a deep vein thrombosis, or a DVT. So, a clot just sitting in a leg vein is definitely not good. But the real danger, the thing that makes this a life or death situation, is when a piece of that clot decides to break off and go for a joyride through your bloodstream. And that little traveler has a specific name you absolutely have to know, an embolus. It's a super important piece of vocab. Just remember, a thrombus stays put, but an embolus is a clot that's on the move. Thrombus stays, embolus travels. Got it? And this little journey here is exactly why it's so scary. So picture it. It all starts with that DVT, deep in a leg vein. A piece snaps off, and boom, it becomes an embolus. It gets swept into the bloodstream, and if it travels up and gets stuck in the lungs, it causes a pulmonary embolism, or PE, which can be fatal. Or, if it finds its way to the brain, it can cause a stroke. This pathway is a critical concept to understand. Now that we know just how dangerous these can be, the next logical question is, who gets them and why? Understanding the risk factors is definitely prime material for exam questions. Here are the big ones to watch out for. Think about things that either damage blood vessels or just slow down blood flow. So stuff like a major injury or a big surgery, especially bone surgery, can be a trigger. Not moving for a long time, like being on bed rest or stuck on a long flight, is a huge risk factor. Then you have other conditions like cancer, being pregnant, using estrogen-based medications like birth control, or having an irregular heartbeat like AFib. All of these things can seriously up the risk of forming a DVT. Okay, time for the pharmacology. This is what you've been waiting for. When we fight clots, we have two main armies of drugs, and it is absolutely 100% crucial that you know the difference between them. So here's the deal. Antiplatelets, think aspirin or Plavix, work by making platelets less sticky. It's like they're putting a non-stick coating on them so they can't clump together and start a clot. We mainly use these to prevent arterial clots, the kind that cause heart attacks. Anticoagulants, on the other hand, are what people call blood thinners. Now, they don't actually make your blood thinner. What they do is interfere with the chain reaction of proteins called clotting factors to slow down the whole clotting process. These are the go-to drugs for treating and preventing venous clots, like DVTs and PEs. While antiplatelets are important, let's be real, the PTCB exam loves to ask questions about anticoagulants. So we're going to zoom in and really get to know the key players in this category that you have to know inside and out. Okay, this table right here, this is study gold. Seriously. Let's walk through it. First up, heparin. It's super fast acting. You give it as a shot or through an IV, and you have to monitor it with a blood test called PT. Next, we've got the old school classic, Warfarin, brand name Coumadin. It's a pill. It's slow to work. We monitor it with the INR test, and, this is a big one, it has a major interaction with diet. And finally, you have the newer kids on the block, the DOACs. That stands for direct oral anticoagulants, like Xarelto and Eliquis. They're also pills, but their huge selling point is no routine blood monitoring needed. Let's really lock in these tests. The prothrombin time, or PT, is the lab test for heparin. It tells the doctors and pharmacists if the dose is working right, strong enough to stop clots, but not so strong that it causes dangerous bleeding. So connect these two in your mind, heparin, PT. And for warfarin, the test is the International Normalized Ratio, or INR. It's basically a standardized version of the PT test, and it's absolutely essential for keeping patients on warfarin safe. So, one more time, warfarin, INR. Burn that into your memory.
All right, time for a little pop quiz. Let's see if you're with me. Of all the drugs we just talked about, which one is the diva that's really picky about what you eat, especially those green leafy veggies? You got it. It's warfarin. And here's why, which is something you definitely need to know. Warfarin works by blocking vitamin K in your body, and you need vitamin K to make those clotting factors we talked about. Well, guess what's loaded with vitamin K? Green leafy vegetables. So the key counseling point isn't that patients have to avoid these foods, but that they need to keep their intake consistent. The same amount day to day keeps their INR stable. That's a classic exam question right there.
Phew, we have covered a lot. So let's boil it all down into the most critical, high-yield facts. This is your cheat sheet. If you're cramming for the test, this is the slide you need to memorize. Okay, let's do a rapid-fire review. Ready? An embolus is a traveling clot, can cause a PE or a stroke. Antiplatelets make platelets less sticky. Anticoagulants slow down the clotting process. Heparin is fast, injectable, and monitored by PT. Warfarin is slow, oral, monitored by INR, and it cares about vitamin K. And finally, the DOACs are oral and don't need routine monitoring. If you can nail these points, you are going to be in fantastic shape for the exam. And that's a wrap on blood clots. You totally got this. Keep studying, stay confident, and remember that we post short, high-yield study lessons just like this one to make learning for your exam easier and way more efficient. Make sure you subscribe to PTCB Prep Guide so you don't miss out on any future topics that are designed to boost your score and help you pass that exam. See you in the next one.